So this is an introduction to the clinical case study requirement for your clinical experience course. This is the same assignment for each semester, but you're going to do a different case study each time. Also, it's important that you review the reading that's also attached to this video, as this is more of an introduction and the reading will go into more specifics. Lastly, if you have questions about how to do case studies or what those look like, I encourage you to read some of the examples that are listed in your reading, or you can just find any case study that you find interesting in the general medical literature. But let's take a look at what specifically I'm asking you to do in these assignments. So the first part of this is I would like you to pick a case that you were directly involved in, right? Ideally, this is something you were involved in, making decisions with, as well as implementing treatment. Now, that's not always going to be able to be completed in that manner, and it is possible to do a case that you were not directly involved in. It's just a lot more work because you have to get a lot more information from those that were actually providing the patient care. And so my recommendation is to choose a case that you were more involved in than a case that you find more interesting. So we also recommend that you pick a case based off of your level in the program. We recommend that level 1 students pick cases involving acute care. Level 2 students can include cases involving modalities and evaluations. And level 3 students will get involved with cases involving more rehabilitation. But you can include different aspects with that. But that's just a good starting point. You should have a good grasp of what you are doing your case study on. So if you're a first semester level 1 student, most of your time has been spent taping and doing some of that acute care, maybe some abrasion, blister management, different things like that. Pick a case that you were involved in there. Maybe it's just a simple ankle sprain, but it's the first one that you did, and so you had some difficulties with it. Maybe it's an ankle sprain and you're taping it and you're asked to do a tape job that you've never done before, or you do your tape job a little bit different and you haven't seen that before, and so you wanted to get more information on that. In your second semester, right, you'll have more emergency management sort of thing. So maybe, a case with a patient that has diabetes perhaps, or maybe an interesting modality case that you do for the first time, if you're comfortable with that towards the end of the semester. Different things like that are good case studies. And then in your level 2 experiences, obviously you're spending a lot of time on the evaluation and management of athletic injuries. So you can do a more normal case study where you would just walk through the treatment plan, including the evaluation for either an upper or lower extremity injury that you were involved in. So from there, once you've selected your case, you're going to write up a case study, and we're going to use an adapted Journal of Athletic Training recommendations. You should always write case studies according to the author's guide, and so you can use this as your author's guide for that. And there's just a few differences with this for being an assignment that I've included compared to just the normal Journal of Athletic Training. But all of these are described in more detail in the reading, so I'm just going to more introduce them here. The first one is an introduction. Obviously, you're going to start with an introduction, and this is going to give some of the background information that the reader would need to understand the case. Now, with that, that's not necessarily the case as it's presented. That will be in the following sections, more in the case description. But like things like epidemiology, different facts about the prevalence or normal treatment or different aspects like that. Any controversies that exist in the literature are all good things to include in the introduction. You should have additional resources and citations in this section where you're bringing in some of the literature that you know about these areas. Then you're going to get into the main body of the case study where you're going to describe the case. And so you're going to work your way through the case and make sure you include everything that has happened and all the pertinent information. There's a lot of detail in the reading on how to do that, but you need to make sure it's one, de-identified, right? We should not be able to know who your patient is that you're talking about with that. And one of the ways to do that is avoid dates and different things that are not pertinent. You're going to describe the initial evaluation. This can either be the initial evaluation for the injury, or if you're just doing a simple tape job, right, as we see with those aspects, you're still going to do some sort of history and examination, even if that history is just, hey, do you need your ankle taped? Have you had it taped before? Did they do anything special? Right, that can be your examination, but you should have some idea of why you're performing every single skill, even if it's something that you're just being asked to do by one of the preceptors, one of the upper level students, or by the athlete themselves. Talk about differential diagnosis, and this has more to do now with the history of case studies often being involved with unique cases and diagnostic case studies. If you don't have a diagnostic case study, you do not need to spend a lot of time in this differential diagnosis. And in fact, some of that differential diagnosis might make their way into things like treatment alternatives, where you might just list the different types of treatments you might do, because that's what you're diagnosing. You're diagnosing an ankle sprain with the possibility of needing a closed basket weave versus maybe a larger tape job with something like a subtalar sling with that. All right, and so that can be your differential diagnosis in there. If you're a level 2 student and you're doing evaluation case studies, then obviously the differential diagnosis comes into play as far as what different conditions you may be thinking at that point before you get into the diagnostic imaging, if those are pertinent, or laboratory tests. The last part of the description of the case is going to be what happened, right? So you're going to describe the treatments, rehab that they might do, as well as the final outcome. So your treatment might be as simple as having taped them up, and the outcome is they went to practice. That's fine. That's the description of what actually occurred. That's all you need to do. At this point, just describe what occurred. Lastly, then, is the discussion and conclusion. And this is where I added several things to this to make it more of an assignment type case study opposed to just a traditional case study. The first is very much from everything else, a deviation from expected. What was different than normal? What was unique? Basically, why did you choose this case study? I ask you then to identify different treatment alternatives, and in this point in time, you can describe why those were decided. Again, this is written in the third person, so describe yourself as the healthcare provider in that case, and describe the thinking process. And this is why a case that you're directly involved in is better than a more unique case, because you won't have access to that information if you were not involved. And so you would have to ask whoever did do that. You're going to then talk about your own personal strengths and weaknesses in handling this case. And then lastly, most case studies end with recommendations for future research. And the idea is, these are low levels of evidence. And so we can't make clinical decisions based solely on case studies. But in this case, I want it to be more future research ideas for you as the student, whether you need to investigate something more. Basically, what are you going to go do now to learn more about this case study? You're then going to write this up according to the guidelines in the reading and submit it on the Canvas page prior towards the end of the semester. As always, if you have questions about the assignment or different components like that, feel free to ask me, ask your clinical preceptors, ask your course instructor, get the help that you need. Anyway, thanks. Good luck.